already joined us. Good evening, Dr. Sheetal.
Can you hear me?
Yes, I can hear you properly. I hope you are keeping all good, Dr. Sheetal.
Oh yeah, perfectly fine. You tell me, how are you?
I'm all good, Dr. Sheetal. Looking forward to this informative session with you today here. So without any delay, let's start today's webinar. First of all, thank you so much, everyone, for joining this platform and for sharing the answers to the poll question. So we are now starting the webinar. Namaste, Sat Shri Akal, Salamu Alaikum, and a very fresh good evening, everyone. This is Sanghamitra, leading the Care Management team at Xyla Health, and I'm your host for the evening today. So to start with, and for a quick introduction, Xyla Health is India's leading AI-powered health management platform that is serving 5 lakh plus patients in 595 plus cities and happens to be the highest rated app with a 4.8 plus rating and delivers 24/7 care. We have been helping people with multiple health conditions such as COVID, diabetes, heart issues, kidney health issues, and women's health issues through a very able and experienced team that is in-house at Xyla for the highest quality care. So today, as you all know, we will be discussing about fertility challenges and treatment. So what are the challenges in natural conception, infertility and its types, and what is the right approach for treatment? So for this, we have with us Dr. Sheetal Agarwal, who is a senior gynecologist and obstetrician with over 24 plus years of experience in this field. She is one of the most renowned pregnancy specialists and infertility specialists. Dr. Sheetal has been associated with reputed hospitals at Delhi, including Safdarjung Hospital, Batra Hospital, and Apollo Cradle, and now associated with Apollo Spectra Hospital. So we are very delighted to have you amongst us today, Dr. Sheetal, and looking forward to this informative session with you. Over to you now.
Hi Sanghamitra, how are you?
Yes, I'm perfect, Dr. Sheetal.
So my hello to everyone. It is very interesting topic and I'm really glad that I'm here to talk on this topic because it is very common and these are, this is something I'm seeing lots of women are facing, that they get married and they have problem in becoming pregnant. So today I'm going to discuss, in gross, what are the common, what exactly is fertility, what exactly is infertility, and what it is that you are doing, you feel that you are doing everything right, then where is the issue that you are not becoming pregnant? So we will discuss that everything in detail. Next slide, please. So what exactly is the process of natural conception? For a natural conception, you need not only a healthy female and male reproductive tract, but you also need healthy ova. For that, you need healthy ovaries and a healthy sperm. And they should fuse in a proper environment for a zygote to form and to get implanted in the uterus. Next, please. Next slide, please, Sanghamitra. So what exactly could be the challenges in the natural conception? So if I come to the female, which is a very, normally हमें लगता है कि the problem is in the female only, but it is not the way. It is not exactly. The problem can be either in the male or in the female partner. So what problem could be there in the female partner? The problem could be in the cervix. Cervix is the mouth of the uterus. Maybe the mucus which is present in the cervix is not allowing the sperm to enter the uterus, or there could be some abnormality in the cervix which is tightly stenosed and closed so that the sperm is not able to enter. There could be some problem could be in the ovaries. There could be ovarian failure. This ovarian failure could be premature ovarian failure, or it could be due to chemotherapy. The ovaries have stopped functioning, or it could be simple polycystic ovarian disease where the eggs are not formed. Ova is formed, but it is not released into the system, thereby causing infertility. Another important aspect of infertility in female could be the tubal factors. Am I audible, Sanghamitra? Am I audible?
Yes, Dr. Sheetal, you are audible.
Okay. Then another important factor in the females could be the tubal factor. Tubal factors is very important cause of infertility in the females. The tubes could be blocked. There could be tuberculosis in the tubes. There could be some infection of the tube, so that the fertilization only is not taking place. Here, I would like to tell you that fertilization between the egg and the sperm always takes place in the tubes. It doesn't take place in the uterus. So tubal factor is very important. If your tubes are not functioning properly, they are blocked, they are stenosed, they have some infection like PID, the chances of infertility is very high. Next, please. Then coming to the male, I have told you earlier that it is not only the female which can have some problem in conceiving, the male partner can also have some problem. Now, what could be that problem in the male? The problem could be in the testes. That is, there could be genetic conditions like Klinefelter disease or something, with the result that the sperms are not being formed properly, or it could be apart from the testes, some, the tract which transports the sperm from the testes to the urethra, that tract could be, there could be some problem in that tract, like it could be atresia of the ducts, or it could be some acquired factor like nerve damage or spinal cord injury, which is not allowing proper erection, proper ejaculation. And they can disrupt the normal transport of the sperm. Next. Then there are factors which are common in both male and females contributing to infertility. In the female, the most common factor is age of the female. Anytime, whenever the female age is more than 35 years, the chances of infertility increases, because the egg which is produced in an older woman, that egg is not a good quality egg. So even if the fertilization takes place, the chances of congenital malformation in that egg is very, due to that aged egg, unhealthy egg is so high that that pregnancy can tend to have missed abortion. So age plays a very important role. That is why earlier, when the ladies used to get married at a younger age, say 20, 21, 22, we had never seen such, incidents of infertility. But now, as the age is increasing, the children are getting married. You see, after they complete their studies, after they're completing their education, after they're properly settled in life, by the time they think of having children, the age has played its role. They are more than 35, 36 years of age. And that is why there is a rising trend of infertility we are seeing in the society these days. There could be environmental factors also which play a role in infertility in both male and females. That could be if you're working in certain industries which produce those chemicals which are detrimental to the sperm production. Chemotherapy treatment, I've already told you, chemotherapy in both male and the female can affect spermatogenesis and the overproduction in the females. These days, there is a fact कि हमें बहुत पतले होना है. Excessive exercise in both male and female. In the males, it can cause decreased sperm motility, and in the females, the excessive exercise and excessive weight loss can lead to loss of periods called amenorrhea, and thereby, ovaries also stop functioning. So whenever you do excessive exercise, up extreme weight loss karte ho, that can also lead to infertility. At the same time, excessive weight gain, obesity, as seen in PCOD, can also interfere with fertility, because tab aapka the egg to banega ovary mein, but it will not be released into the system, leading to infertility. And of course, if you are using certain substances like marijuana, smoking, tobacco, drinking, all this can reduce the fertility, and it can cause infertility in both male and female. Excessive drinking is very common. I have seen so many cases of excessive drinking where both, either the male or the female, they are chronic alcoholics, and when they come to me, I tell them that you have to have a healthy lifestyle. Aapko apna alcohol intake kam karna padega before you can think of having pregnancy. Next, please. Now, what exactly, how do you define infertility? क्या अभी 2 महीने पहले शादी हुई है, बच्चा नहीं हुआ, तो क्या हम उसको infertility बोलेंगे? No, it is not that. According to our books, there is a protocol कि if you are unable to conceive within 1 year of marriage, of having unprotected and regular sexual intercourse, if for 1 year you are not using any precautions, you are having regular sexual activity, unprotected sexual activity, and you are not able to conceive, that means you are an infertile couple. You have to be investigated further. And normally it is seen in 10 to 15% of the healthy individuals that in spite of having regular sexual activity, they are not able to conceive within 1 year of their marriage. Next, please. Now, what again, fertility is of two types, primary infertility and secondary infertility. By primary infertility means that you have never been able to conceive, आप कभी pregnant हुए ही नहीं. Secondary infertility means that you had become pregnant sometimes earlier. That pregnancy may have ended in a live pregnancy, live birth, or it could have ended in abortion. Whatever the scenario is, पर आप pregnant हुए थे. Whether the outcome was favorable or unfavorable, that we don't consider. But yes, you had become pregnant and now you are having difficulty in pregnant. That is a secondary infertility. Next. Next, Sangamitra. So here I would like to tell you, हम बहुत बोलते हैं IVF, IVF, IVF. Do you know that first successful IVF was done in 1978 in England with the delivery of Lewis Brown. And that was the beginning of the new era for the treatment of infertility. You know, it gave hope to millions and millions of people around the world. Otherwise, those ladies, you know, who used to live with the stigma कि ये तो pregnant नहीं हो सकती. The advent of IVF gave a new hope to all these couples, and I'm very glad to say that now it is so common with IVF that majority of them, you know, who were not able to conceive earlier, they are given a chance to become pregnant. So it is, and again, as I've told you earlier, infertility is no longer regarded as the problem of the female. 40% of the cases of infertility are due to problems in the men. Therefore, modern infertility treatment focuses on the couple as a unit. ऐसा नहीं है कि हम सिर्फ female को treat करते हैं. Whenever a couple comes to us for infertility, we treat both of them as a team. दोनों में हम positive और cause ढूंढते हैं. What is the cause of infertility? Whether it is in the female and the male, and accordingly a treatment plan is devised and we start the treatment. Next. How do you do the evaluation? I have told you that both the partners, when a couple comes with both the male and the female are taken as a unit, are considered as a unit, and दोनों का investigations होता है. Diagnostic testing is unnecessary if the couple has not attempted to conceive for at least 1 year. What does it mean? That means अगर आपको 1 साल हो गया है शादी को and you had regular and unprotected sex and you are not able to conceive, then after 1 year we do the diagnostic testing. But this diagnostic testing can be done even if it is lesser than 1 year of your married life, provided the woman is of an elderly age group, she is more than 35 years of age. There is history of male factor infertility. That means that the male had been married earlier, but he never had any children from the earlier marriage also. In the female, there is history of endometriosis, history of operated ovarian cyst, history of pelvic inflammatory disease or any pelvic surgery. If any such history is present, we start investigation of the couple before they complete mandatory 1 year of their, you know, regular sexual, unprotected sexual activity. In conditions में हम पहले से ही treatment diagnosis बनाकर treatment start कर देते हैं. Next. So a complete infertility evaluation is performed according to the woman's menstrual cycle. We ask menstrual history is very important. Whenever you take a patient of infertility and you start assessing them, first and foremost is the menstrual history, whether the periods are regular or not. ऐसा तो नहीं है periods 3-3, 4-4 महीने में आते हैं and then she bleeds continuously for 15 days, या 2-3 दिन के बाद 2-3 दिन के लिए आते हैं and then again it comes after 3 to 4 months. This menstrual history is very important because this menstrual history gives us an idea कहीं polycystic ovarian disease तो नहीं है. So accordingly the treatment is in that lines. So history gives us proper history if taken by a person who knows how to take the history. It is very important. History से ही हम majority of the times history leads us to a diagnosis. So हमें क्या information मिलती है जब हम history लेते हैं, apart from the menstrual history, whether she has been, her obstetric history is also taken in detail, कि what is the कितना time हो गया marriage को, whether she had any pregnancies before, whether she, all those pregnancies, what was the outcome, whether they ended in abortions or she had a full-term pregnancy or they ended in a preterm labor. All this history is very important. And of course, sexual life history is also taken in detail, that whether the couple is staying together or they stay separately, they meet once in say 2 to 3 months. What is the frequency of intercourse, whether any lubricants are being used, because lubricants have many a times permissible agents in them which destroy the sperms, whether any vaginal douches are used after any sexual activity, whether there is any sexual dysfunction, like whether there is premature ejaculation or erectile dysfunction. So this history is very important. This history gives us an insight into the problem, and many a times हमें एक diagnosis मिलता है if proper history is taken. Next. So I've told you female menstrual history is important. Male medical history is equally important. So hum male se we ask whether any time semen analysis was done earlier also. And here I would like to tell you that semen analysis is always done after 3 days of abstinence, because that gives us the true picture of the semen in the male. History of premature ejaculation, history of change in libido, everything is asked in detail in the male. Very important is the alcohol consumption, tobacco consumption, and any recreational drugs are being used by any partner, both male or female. Aapki occupation kya hai, whether the underwears that you are using in the male, especially if it is very tight, it can to some extent semen production ko control, wo kam karta hai. What are the physical activities they are doing? All this history is taken in detail, and we completely review the system, a system of both the male and female, to identify any endocrinological or immunological issue that may be associated with infertility. So history is very important. History से हमें काफी हद तक पता चलता है क्या problem है. Next. So उसके बाद once proper history is taken, what are the investigations to be done? First and foremost, we go for the pelvic ultrasound of the female. Before doing HSG, we do the pelvic ultrasound of the female to see कि उसका uterus कैसा है, कोई cyst तो नहीं है, कोई fibroids तो नहीं है, the uterus कोई छोटा, मतलब the size of the uterus is normal size, the ovaries are normal, bulky ovaries तो नहीं है. So pelvic ultrasound is the backbone of any infertility investigation we carry out. After that ultrasound, but earlier we used to do hysterosalpingography. It is a very painful procedure. Many doctors have abandoned it, but yes, in some areas they do a hysterosalpingography, where is in the X-ray room dye is injected into the uterus to see for the patency of the tubes. But it is so painful that I personally don't agree to this test. You can go for laparoscopy. Hysteroscopy is again, after ultrasound. Normally, if the infertility duration is of a longer time, I would like to attempt a laparoscopy, hysteroscopy. अगर ultrasound बोलता है कोई cyst है, तो laparoscopy से we remove the cyst. And if the tubes are blocked, we try to open the tubes by laparoscopy. Hysteroscopy gives us direct visualization of the endometrial cavity. Many a times the cornua, which is the openings in the uterus to the tubes, they are blocked, which can be opened by hysteroscopy. So laparoscopy, hysteroscopy is a very important investigation to assess infertility. Of course, you can do various tests like progesterone levels, or level. You can go for their serial ultrasound to assess the ovulation, to see whether the eggs are being formed or not. You can go for the level of the ovarian reserve and the age of the female partner. They are very important prognostic factors in the fertility workup. Next. So how do we come to know the ovarian reserve? Next, Sangamitra. So ovarian reserve is very important. You can do ovarian reserve tells me what is the status of the ovarian ovaries in this patient, whether she has adequate amount of follicles, eggs in her to have a normal pregnancy later on. तो ये हमें कैसे पता चलता है? Very important. Anti-Mullerian hormone test is done. Normally, its range should be between 2 to 6. अगर रेंज 2 से कम है, that means ovarian reserve is very poor. अगर 6 से ज़्यादा है, that means she could be having polycystic ovarian disease. So anti-Mullerian hormone is a very important test. Of course, you can do on day 3 of the period, you can go for FSH and estradiol levels. That will also tell me her ovarian status. You can do clomiphene challenge test. We don't do it these days unless and until I'm doing ovulation induction. I never go for clomiphene challenge test. You can go for serial AMH assay also can we do. You know, we do AMH for 1, 2 or 3 months to see what is her AMH status, AMH values, and this will give me an idea what is the ovarian reserve of this patient. Next. Semen analysis in the male, first and foremost, and I think the only test is the semen analysis, which should be done after 3 days of abstinence. We see the amount, the volume, pH, everything is, we come to know by the semen analysis. You can go for specialized sperm function tests also on this semen analysis. Of course, the ultrasound in the male testicular system is very important to rule out varicocele. क्योंकि अगर वेरिकोसील है, simple surgery of varicocele can improve the semen status. So ultrasound is very important in both male and the females. And one can also do complete extensive physical examination of the male is done. Normally it is done by a urologist. A gynecologist will not do the detailed physical examination of the male. But male semen analysis is the backbone of the male diagnostic test to be done in the male partner. Next. So what treatment options are available depending upon the diagnosis? मैंने लेप्रोस्कोपी, हिस्ट्रोस्कोपी फीमेल में करी, अल्ट्रासाउंड करा, मेल का मैंने सीमेन टेस्ट करा, उसका कलर डॉपलर करा, अल्ट्रासाउंड करा. So I come to the conclusion, what is the problem? Whether the problem is in the male and the female. And depending upon that, we plan the treatment in that couple. If female is having any underlying female or male factors affecting the fertility, we try to do that. Like agar uske cycle irregular hai, usko PCOD hai, we first of all try to treat the PCOD of the patient. If the patient is obese, we tell her to lose her weight. You know, her BMR should be less than 30 if she wants to have a pregnancy. PCOD है, लेप्रोस्कोपिकली हम ओवेरियन ड्रिलिंग करते हैं, 3 से 6 महीने ट्रीटमेंट देते हैं till and after that the ovaries start ovulating. So depending कि मेरे जो हमने various diagnostic tests करे, क्या मेरा diagnosis बना है, उसके हिसाब से treatment options available होते हैं. First and foremost we try, हम IVF और assisted reproductive technology में last में जाते हैं. हमारा मेन ये होता है कि we should try to identify the problem, treat the problem. अगर हमें लगता है कि नहीं ये problem treatable है, then only we opt and we give the suggestion for IVF and various assisted reproductive techniques. IVF and IUI are the last options to be given. Suppose female के tubes blocked हैं, so there is no point in telling her कि आप you can have natural conception. तब तो IVF option है, IUI भी option नहीं है. Suppose उसके ultrasound में multiple fibroids हैं, I have to do myomectomy first. Uterus को proper shape में लेके आना है before she can become pregnant. She has PCOD. I have to treat PCOD before I have to, give her की assisted reproductive ART का मैं कोई उसको दूंगी. Before that, I have to treat PCOD. So it is very important that the treatment depends upon the underlying cause. And the various diagnostic criteria tells me what is the problem of infertility in this, and accordingly एक plan बनाया जाता है, various options दिए जाते हैं given to the patient, and we move ahead. Next. So what exactly is IVF? IVF क्या होता है? In vitro fertilization, it is a process in which a man's sperm and a female eggs are combined outside the body in a laboratory dish, and on day 6 to day 7, when a zygote is formed, embryo transfer is done in the female uterus. Various methods. जब 1978 में first time आया था, it was in a very crude stage. Now it has become a very refined process. we can, if the uterus, agar female ka uterus nahi hai, but she has ovaries, then also she can have her own genetic child. We can use her eggs. We can use the sperm of the partner. Take the help of the uterus of a, donor, surrogate ka uterus leke, that zygote is implanted into the uterus of the surrogate. So, तीन लोगों की हेल्प ली है, द ओवरीज ऑफ द पेशेंट जिसका यूट्रस इज नॉट सुटेबल, either she has no uterus, maybe it was removed due to some surgical problem, or the uterus was not suitable for implantation. The sperms were taken of the partner, uterus is used of the surrogate, and by this method they can have their biological genetic child. नॉर्मली ईटी में जब हम एम्ब्रियो ट्रांसफर करते हैं, मोर देन वन फर्टिलाइज्ड एग्स इज ट्रांसफर्ड, दैट इज व्हाई मल्टीपल प्रेगनेंसी के चांस ज्यादा होते हैं, क्योंकि वी आर नॉट श्योर कि अगर हम एक ही फर्टिलाइज्ड एग डालेंगे वेदर इट विल इम्प्लांट और नॉट. तो नॉर्मली हम 3 से 4 फर्टिलाइज्ड एग डालते हैं, तो होता है कि चलो एक या दो तो इम्प्लांट होंगे यूट्रस के अंदर, एंड हेंस द बाय इन आईवीएफ द चांसेस ऑफ मल्टीपल प्रेगनेंसी इज वेरी वेरी हाई. बेसिक स्टेप आईवीएफ में यही है कि हम ओवेरियन स्टिमुलेशन करते हैं बाय इंजेक्टेबल्स. देयर आर 2 मेथड्स, डाउनग्रेड मेथड, अपग्रेड मेथड. आई डोंट वांट टू गो इनटू डिटेल. After ovarian stimulation, once the eggs are formed, eggs are retrieved, multiple eggs are retrieved, fertilization takes place outside the body in the embryo culture, and then embryo transfer or ET is done on day 7, day 8 of the zygote formation. Next. I don't want to go into detail of this gift and zip procedure because they are generally not done these days. Gift mein gamete is transferred inside the fallopian tube, and by laparoscopy this procedure is obsolete. Similarly, zygote is transferred in the fallopian tube via laparoscopy. Again, this is an obsolete procedure. Normally, it is done where the embryo is transferred inside the uterus of the mother or of the surrogate. Next, please. Next. So what preventive measures can you take? How is it that you should, what preventive measures आप लोग की, so that you don't land up in being an infertile couple? My first and foremost advice is get married at a right age, like you don't have to wait to finish your studies, to establish your career, आजकल के जो generation है, this millennials and Gen Z, they think कि हमें पहले proper education लेनी है, फिर हमें proper we should attain that level कि हमारा अपना घर हो, गाड़ी हो, कोठी हो, और एक नहीं दो घर हो. The biological clock is running. My request to all these millennials and Gen X is कि time will not wait for you. If you don't want to land into an infertile couple, and if you think that you want to have a child, plan a baby, have a child, then you can pursue your other interest in life. If you still are hesitant to have a child, at least go for your egg preservation, especially in the females. आपको लगता है कि biological age is running, preserve your eggs so that later when you think that you are ready to become mother and to take the responsibility, you have good quality eggs preserved and you can go for IVF procedures. Other than that, while having sexual activity, avoid the use of lubricants, because these lubricants are generally have lots of spermicidal agents in them which destroy the sperm motility and function. Healthy lifestyle is very important. Please see to it that your BMI doesn't become more than 30. Adopt a healthy lifestyle. Include physical activity in your day-to-day routine. Have a healthy food. Do regular exercise. Avoid stress. Any kind of stress, physical or mental, should be avoided. And another thing which is important is alcohol consumption. These days, I'm seeing that alcohol consumption in the youngsters is on a high. And more than that, they go for binge drinking. Means first Monday to Friday, they work very hard, and then Friday, Saturday, Sunday, they go for binge drinking, which can be very detrimental to your sperm and overproduction. So if you want to consume alcohol, it should be in limit, should not exceed more than 30 to 60 ml. Of course, smoking is very bad because smoking also, impairs not only your sexual activity, the sperm quality is affected, the egg quality is affected. And even if you become pregnant and you continue to do smoke, you can have intrauterine growth retardation in the child. the child can have congenital malformation, you can land into preterm labor. So guys, if you're thinking of having a child, you have to quit smoking, drinking, tobacco consumption, and various substance consumption has to be, you have to quit it. And of course, consult your physician if you think that it has been 1 year of having unprotected and regular intercourse, just not become pregnant. Time has come to consult your physician and to find out why you are not becoming pregnant before it becomes too late and nothing could be done about it. Next. So thanks. Is there any questions?
Thank you so much, Dr. Sheetal, for making us understand about fertility, infertility, and what is the right approach for the same. Really happy to see that we have so many questions in the chat box section. We will now be opening up our platform for Q&A. So the first question that we have received, and for others as well, if you have any question, you can share those in the chat box section, or you can unmute yourself and ask your question directly. So, Dr. Sheetal, the first question that we got was from Mr. Khalid, I think. So the question was, please explain about ectopic pregnancy.
See, ectopic pregnancy, any pregnancy outside the uterus, pregnancy implantation should always take place in the uterine cavity. If the implantation has not taken place inside the uterine cavity, other than uterus, अगर वो कहीं पे भी implant हुआ है, it could be in the tube, it could be in the ovary, anywhere, that is an ectopic pregnancy. These days, we have medical management of ectopic pregnancy also, and wherein we give injection of methotrexate, but उसके लिए कुछ guidelines होती हैं. If your ectopic pregnancy falls under those guidelines, then we do medical management by giving injection methotrexate and serially following the beta HCG level on 0, 3, 5, and 7 days. Many a times when your medical management fails, in that case surgical management is done. अगर ectopic rupture हो गई है या उसके अंदर ectopic pregnancy में heartbeat आ गई है, तब medical management का कोई रोल नहीं होती है. In that condition, we do laparoscopy and many a times हमें कई बार ट्यूब भी निकालनी पड़ती है इस condition में to save the mother.
Thank you so much, Dr. Sheetal, for explaining that in detail. The next question we have got from Miss Aarti. So the question is, I had 2 miscarriage 60 days. We both took chromosome karyotyping test recently with both of our and our family's medical history. The parameters are normal. Doctor told us these miscarriages are the normal 2 to 3% probability of miscarriage and asked us to leave a gap of 2 months. So I'm still afraid of the future pregnancy. Could you please advise on the things that I need to care?
See, in 99% of the cases, first trimester abortions, that is the abortion which takes place at 5 to 6 weeks of pregnancy, are due to congenital malformation. तो हमें क्या करना है उसको avoid करने के लिए? For 3 months continuously take folic acid supplementation. अगर आपका weight ज़्यादा है तो अपना weight कम कीजिए. Adopt a healthy lifestyle. Include exercise in your diet. Start taking folic acid supplementation. अगर vitamin D3 deficiency है, please include vitamin D3 also in your diet. Start taking vitamin D3 supplementation also. Then I'm sure next pregnancy is going to be normal pregnancy.
I hope that answers your question, Ms. Aarti. If there's anything else, you can let us know. So moving on to the next question. Yeah, so I think this was again in correlation with the question asked by her, that she also mentioned that I got married before 1.5 year. I'm 25 and my husband is 29. So, okay. So apart from this, Dr. Sheetal, since you have been working as an infertility specialist as well, from your practical experience, have you seen or have you generated this insight now that the infertility is getting more common these days?
I told you, I have explained it, why infertility is getting common. I think I have explained in my talk very clearly that people don't want to, so they are getting married late. After that, they wait for 3, 4, 5 years, before they think time has come for us to become pregnant and to expand our family, without realizing that time kisi ki wait nahi karta. Biological clock is running. The moment the lady becomes an elderly prime, she becomes more than 35, 36 years of age, She does not only has problem in becoming pregnant, but that pregnancy can also land into many complications. She can have high blood pressure, she can have diabetes during her pregnancy, child can have congenital malformation. So whenever I give talks on multiple platforms, I always tell them that please don't let your biological clock defeat you. अगर आपको नहीं करना, that is your decision. अगर आपको बच्चा करना है, see to it that you have one child before 35 years of life. Otherwise, आप चाहते हो कि आप अच्छे से सेटल होना चाहते हो, then go for your egg preservation. Many young girls are doing that. 28, 29 में they get their eggs preserved, and when they think that they are ready for pregnancy, they use those eggs, and by IVF they become pregnant. See, अगर हमारे पास ये latest technology है, then we should use them wisely. If we use them wisely, I'm sure कोई ऐसी problem होगी ही नहीं.
Thank you so much, Dr. Sheetal, for explaining us about that. Dr. Sheetal, as you always say that one should have a gynecologist as a friend by their side always. So, as you also talked about the approach that we should take if someone is not able to conceive at the right age, at the right time, one should consult the gynecologist first of all and understand that what are the next steps that needs to be taken, right? So, just want you on this platform to highlight that people are still scared of reaching out to gynecologists that, okay, they will advise me test or they'll advise me some kind of medicines or extra things that needs to be taken care of. So if you can just highlight on those points, doctor.
I didn't get your question. What exactly do you want me to highlight?
Yeah, so Dr. Sheetal, I'm saying that we have seen in our patient base, in our in at Xyla as well, that whenever people face some issues, they are very hesitant to reach out to the doctors, general physicians, or gynecologists, highlighting their issues because they are scared of the next steps. So, taking this platform as a communication medium for all the audience that have joined today, just want you to highlight on the fact that how approaching a doctor at the right time will help them and not cause unnecessary tension or stress in their life.
For this, I have always told you that all of you should have a gynecologist as your friend with whom you can go and discuss all your problems rather than following in that rut of कि मैं अपने पड़ोसी से पूछ लिया, अपने friend से पूछ लिया and Google कर ली, everything that is there on Google is not correct. Always go to a proper gynaec, discuss your problems. हमें अपनी body से ज़्यादा we know about our body more than anyone else. तो हमें लगता है कि कुछ दिक्कत आ रही है, हमारे periods regular नहीं है, या bleeding कम हो गई है, या ज्यादा हो गई है, या periods के बीच में intermenstrual bleeding हो रही है, या sex करने के बाद bleeding हो रही है. Anything that happens has to be discussed with your doctor because a stitch in time saves nine. कोई प्रॉब्लम शुरू में ही अगर पकड़ी जाती है तो इजीली ट्रीट हो जाती है, कई बार बिना सर्जरी के ट्रीट होती है. और अगर हमें उसको बाद में पता चलता है, जैसे पॉलिप हो गया, इतना बड़ा हो गया कि बाद में इतनी हमें यूट्रस ही निकालना पड़ा, तो अगर हमें पहले ही पता चले तो छोटी स्टेज में हिस्ट्रोस्कोपिक पॉलिपेक्टमी कर देते हैं. सो ऑलवेज हैव योर गायनिक, उस नंबर इज देयर विद यू, जिससे आप जाके अपनी कोई भी पर्सनल बात शेयर कर सकते हैं.
थैंक यू सो मच डॉक्टर शीतल. Dr. Sheetal, there's one more question. Although we have discussed this, the first question that was asked on ectopic pregnancy, the question is now asked by Mr. Biswajit that why ectopic pregnancy happen and how to prevent if a lady has previous history of ectopic pregnancy.
See, normally ectopic pregnancy होती है अगर there is a history of pelvic inflammatory diseases, the chances of ectopic pregnancy are there क्योंकि ट्यूब्स जो होती हैं वो डैमेज हो जाती हैं, उनकी मोटिलिटी कम होती है, तो फर्टिलाइजेशन ट्यूब में होती है पर वो जाइगोट को वापस यूट्रस के अंदर नहीं इम्प्लांट कर पाते, तो ectopic हो जाती है. That is one of the reason, but many a times there is no reason for ectopic pregnancy. और अगर आपको एक बार ectopic pregnancy हो गई है, the chances of having ectopic pregnancy in your next pregnancy is also very high. तो अगर आपकी एक ट्यूब रिमूव हो चुकी है और आपके पास एक ही ट्यूब है and you become pregnant, you immediately consult your doctor to see कहीं वो दोबारा ectopic तो नहीं हो गया. So the chances of having a recurrent ectopic is also very high.
Thank you so much, Dr. Sheetal, for answering all those questions in such detail. I hope that everyone was able to understand the right approach that Dr. Sheetal discussed in today's webinar. If there are still any questions that are unanswered, आपके कोई भी सवाल है जो आप अभी नहीं पूछ पाए या आपके मन में और सवाल है जो आप बाद में पूछना चाहेंगे, please do reach out to us. We'll definitely get the right answers from Dr. Sheetal. So thank you so much everyone for joining in for today's webinar. I hope you were able to take the notes. Thank you so much, Dr. Sheetal, for being on this platform.
Thanks, Sangamitra.
Thank you. Please stay.
Bye.